In this video, we're going to talk about coronavirus, COVID-19 and obesity. There's growing evidence in the UK and around the world that being obese or overweight puts you at greater risk of serious illness or death from COVID-19. So, what's the link between obesity and COVID-19? Stay tuned to find out. What is COVID-19? 2020 has seen the world being gripped by COVID-19, an infectious disease which is caused by a novel coronavirus. Many people infected with COVID-19 can suffer a range of mild to moderate respiratory disease and symptoms such as high temperature, a persistent cough, and sore throat. Many can also be symptomless. However, for some people, COVID-19 will cause more severe symptoms and it can adversely affect the lungs and many other body symptoms, and it can cause death. The statistics show that the daily number of confirmed cases in the UK and the number of people dying because of COVID-19 keeps going up. Some people are more at risk of developing serious illness if infected by COVID-19. These include older people, people with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and a current or recent cancer. Also on the list are people living with severe obesity, as they are deemed to be clinically more vulnerable. So why is being obese on the vulnerable list? Well, research has shown that living with obesity seriously affects people's quality of life and their health. It increases the risk of high blood pressure, heart attacks, stroke, heart failure, type 2 diabetes, non-alcoholic fatty liver disease, and some cancers in adults. That's quite a long list of health risks. Compared with individuals of a healthy weight, the life expectancy from age 40 years was 4.2 years shorter in men living with obesity and 3.5 years shorter in women living with obesity. The most widely used method to check if you are a healthy weight is the body mass index, or BMI. BMI is a measure of whether you're a healthy weight for your height. For most adults, a BMI of 18.5 to 24.9 means you're a healthy weight. 25 to 29.9 means you're overweight, 30 to 39.9 means you're obese, and 40 or above means you're severely obese. BMI is not used to diagnose obesity because people who are very muscular can have a high BMI without much fat. But for most people, BMI is a useful indication of whether you're a healthy weight. A better measure of excess fat is waist size, which can be used as an additional measure. People living with obesity are more likely to experience respiratory issues, including obstructive sleep apnea, compared with people with a healthy weight. Obesity is also associated with asthma. What causes obesity? Obesity is caused by consuming more calories than the body uses, which over time results in excess weight being gained. It's estimated that on average adults in England are consuming 200 to 300 excess calories per day. But there are other factors that also play a part. These are environmental, behavioural, biological, societal and cultural. So what is the link between obesity and COVID-19? Obesity has been linked to an increased likelihood of being admitted to intensive care units (ICU) with serious complications related to COVID-19. A new Public Health England report summarises findings from evidence published during the pandemic on the effects of excess weight and obesity on COVID-19. The findings so far from several different study types, including clinical audits of patients with COVID-19 in hospital and routine primary care records, early systematic reviews and meta-analysis carried out in the UK and other countries, have shown a relationship between weight status and COVID-19 outcomes. It seems living with excess weight is being consistently reported to be associated with an increased COVID-19 risk. The risks seem to increase with increasing BMI above the healthy weight range, even after adjustment for potential confounding factors, including demographic and socio-economic factors. However, there are a number of limitations in the evidence to date, including sampling and testing strategies, unequal exposure to COVID-19, sample sizes, and limited number of COVID-19 infections. Saying that, the systematic reviews so far have found that patients with severe COVID-19 had a higher BMI compared with patients with mild COVID-19. So why does excess weight increase COVID-19 severity? Number 1, physiological implications. We know that most people infected with COVID-19 virus will experience mild to moderate respiratory illness. Having fat deposition around the upper airway and a heavier chest can reduce lung function, which, along with the effects of the virus, may affect circulating levels of oxygen. Number 2, excess adipose tissue. Due to adipose tissue, body fat containing high levels of the angiotensin converting enzyme 2, the enzyme that the virus latches onto to gain access to cells, this may make adipose tissue more susceptible to infection. Number 3, inflammatory and immune response. We know obesity can create a pro-inflammatory and oxidative stress environment, which is not a good thing. COVID-19 can cause the immune system to go into overdrive and attack itself. This may be even worse for someone who is obese. The risk of complications may be increased due to the increased inflammation and changes to the normal immune response in the bodies of people carrying excess weight. Number 4, increased risk of infections. Obesity may increase the risks of infection, leading an exaggerated hyperimmune response. At the same time, obesity may lessen the body's ability to cope with the multiple effects of the virus-induced immune response. Again, this is not a good thing. Number 5, psychosocial factors. People living with obesity suffer stigma and discrimination. This could mean that people living with obesity are reluctant to access healthcare or may delay seeking care until the disease is more advanced, which may lead to a poorer outcome. So, could weight loss help reduce COVID-19 severity? There is growing evidence to show that living with excess weight puts people at greater risk of serious illness or death from COVID-19, with the risk growing substantially as body mass index increases. Nearly 8% of critically ill patients with COVID-19 in intensive care units have been morbidly obese, compared with 2.9% of the general population. Losing weight can lead to improved cardiovascular risk, reduced joint pain and stiffness. And in individuals with prediabetes, for every kilogram of weight lost, there was a 60% reduction in the risk for progression to diabetes. So there are definitely benefits of losing weight and reaching a healthier weight. Let's sum up with an all things nutrition review. Obesity is on the rise, and the impact on health and life expectancy has been known for years. It's clear from the evidence so far, even with its limitations, that people with COVID-19 who are living with overweight or obesity are at a notably increased risk of serious COVID-19 complications and death. Even though there is currently no research on the effects of weight loss on COVID-19 risks, for people living with obesity, weight loss has been shown to bring health benefits. So, reducing excess weight could help reduce the risk of severe COVID-19 illness. It seems COVID-19 is not going to go away anytime soon. While reducing excess weight may help in reducing the severity of COVID-19, the importance of good nutrition also can't be underestimated. But watch out, there are lots of widespread claims and misleading information being shared online of food and drink and coronavirus. If you haven't watched our video where we myth bust 6 coronavirus nutrition claims, I'll leave a link in the description below. Good nutrition tends to correlate with a healthy, functioning immune system, while poor nutrition correlates with the opposite. Adopting a healthier lifestyle may help to drop the excess pounds and help the immune system. There's no one magic solution to achieving weight loss. One of the biggest factors is finding something you can stick to. The important thing is to find the path that is right for you, an approach you can sustain over the long term that fits with your lifestyle. Seek advice from your health providers about the support available to you. If you enjoyed this video and found it useful, hit the subscribe button to watch more videos like this. Remember, stay well and healthy. Catch you next time.